Everyone, hi, my name is Paige. I am a fourth year MD MPH dual degree candidate. My concentration is behavioral and community health sciences, and I'm going to talk about how I've applied my MPH kind of coursework and experience to some women's health outreach and service. All right, so a little bit about me. I am originally from Baton Rouge, Louisiana. So Louisiana is home to me and really my favorite place to be. I went to Spring Hill College in Mobile, Alabama, which is a small liberal arts Jesuit college. And it was really there that I first kind of learned a lot about health disparities. I was engaged in a lot of social justice work and conversations, both in the classroom and out. I volunteered at a nonprofit health clinic. I did some international service work. And so all of those things kind of led me to decide to pursue an MPH. I already knew that I wanted to go to medical school, but I kind of wanted to broaden my experience and my skill set. So I definitely knew I was looking for a program that I could do both my MD and my MPH together. And it was kind of at a time that I missed being in Louisiana. I really have always loved the high risk population here. And so I definitely had a strong pull to come back to LSU for my public health and MD training. So I chose the behavioral and community health concentration because I felt like it's where most of my interests lie in public health at the time. And that's kind of continued. I wasn't as interested in policy work. I'm prefer to be more boots on the ground, kind of working within the community. And much like Dr. Gee, my interests have very much been in maternal health, women's health, and reproductive rights and justice as well. I would not be who I am without the support of my husband, Andrew, as you can see here, and our dog, Leo, who is our pandemic puppy. We did the same thing. So he is 7 months of excitement and joy. And when I'm not working and in medical school, we enjoy being outside and hiking, which is not very much of that in Louisiana, but we certainly can easily get around and get outside of New Orleans from here. And that's what we do. So the main thing I'm going to talk about today is my time with the New Orleans Women and Children Shelter. So that is the only women's shelter in New Orleans. It's located in Central City. There's a couple of other homeless shelters in the city, but this one is specifically for women and children. And then I'm going to talk about my work with the NOWS Outreach Group, which is a service group on LSU's campus that serves this shelter. So what is NOWS Outreach? So it actually started back in 2015 through the Albert Schweitzer Fellowship. It was a project that 2 medical students started to bring education and healthcare access to the women at this shelter. So it's an interprofessional student-run program. So that means students in all of the different schools at LSU run this program together. It's not just one school, which was really important to me. To kind of expand my knowledge of how to work with other people in healthcare. I very much knew the MD and the public health side of things, but being a part of this organization allowed me to work with nursing students, dental students, allied health, pretty much you name it, I've gotten to work with them. So the main purpose of the group is to provide educational workshops, presentations, and some health screenings and clinics, not full-blown clinics, but more so screening efforts to the residents here, because a lot of them are in a transition. They're not really here at the shelter very long. They're here maybe 2 to 3 months, but the ultimate goal is to get them back into their own housing on their 2 feet with a job. So my role kind of throughout my 4 years of schooling have been, I started off as a volunteer in my first year and then became a co-director and then an advisor my second, third, and fourth year. And I've kind of translated a lot of my work into research, which was not expected, but I think a lot of public health ends up that way. You don't expect to turn things that you're doing into a next project, and that's just what happens. So just some examples of some of the programming we do at the shelter. I mentioned some of kind of the screenings and clinics. So basic health screening, dental health screening. We ran a vaccine clinic, which I'm going to talk a little bit more about in depth. Lots of hip hop dance classes. We did CPR and stop the bleed training, and a lot of mental health screenings as well. A lot of the education topics are driven by what the women who are currently there at the shelter want. So a big lesson I learned through being a leader here was that it's not always what you think people need is what they need. And so by listening to both the staff at the shelter and just the women themselves, we kind of started doing surveys and asking, well, what do you want to learn more about? Or what area would you be interested in? And a lot of times it was women's health, it was sexual health, it was things that we were happy to provide, but really surprised us. We thought they needed more job help or health for their children, but they really wanted to talk about things like sexually transmitted infections and contraception and when to see their OBGYN, and things like that. So it was really, really wonderful for me, someone who was interested in women's health, to kind of hear a lot of what their concerns and questions were. So kind of bringing my public health perspective to this role that I played, we noticed that a lot of the women were not getting vaccinated for a lot of different things. One of our big goals was to kind of work on getting the HPV vaccine to these women, but it provided a little bit more of a challenge than what we were able to kind of do as a student volunteer group. So we decided to kind of pilot what would a vaccine clinic look like at a homeless shelter with the flu vaccine. So the flu vaccine is something everyone should get every year. We were able to give it to the women and the children. So this was a really good kind of pilot program. So some of the barriers we noticed in our community at the women's shelter were that they had a lack of transportation of getting to health clinics or really knowing where to go to get vaccines. A lot of clinic hours are not convenient for people who are working, and often working more than the average working wage week. There was no affordable childcare for their children if they were trying to make doctor's appointments. A lot of them didn't have primary care physicians they normally and regularly saw and were advised to get some of these vaccines. A lot of them, especially the children, had missing or incomplete vaccine records. And a lot of just kind of conversations with the women, they didn't know a lot about vaccines and didn't have that kind of urgency to get vaccinated in a lot of different areas. They just perceived the risk being very low. They weren't familiar. They were a little uncomfortable with the thought of vaccines. So these were kind of all the things we wanted to address with this clinic. So kind of logistics, I think that lesson I've also learned in public health is who can you partner with? It's kind of, you get things done by partnering with people who have access and funding that you need for whatever you're trying to accomplish within your community. So because NOW's outreach is under the LSU Public Health umbrella, I worked with Dr. Donna Williams pretty closely, and she pointed me in the direction of the Louisiana Department of Health to see if we could get the flu vaccines donated, which we did. We got 100 vaccines. NOW's outreach had a lot of funding, so we get funding both from donations from the community and writing grants. So we were able to purchase any of the supplies we needed to carry out a clinic. We actually ended up registering NOW's as a LINK site. So LINKS is the Louisiana Immunization Network Registry, where everyone's vaccine records are kept. So when you get those printouts from the doctor when you were like younger and had to have it for school, it's all through LINKS, but actually anyone can register a site as a LINK site. You don't necessarily have to be a medical provider. You just have to have some kind of medical supervisor. So we brought in an LSU pediatrician to kind of be our supervisor for the clinic and set up NOW's as a LINK site so that we could print those vaccine records for the families and also see what gaps they had in their vaccine records. And then we partnered also with the LSU Student Run Homeless Clinic group. So this is a group of medical students who provide clinic services to the other homeless shelters in New Orleans, and they get formal training in vaccine administration. So we wanted to make sure we had people who were properly trained to give the vaccine. So kind of the workflow, the LSU pediatrician was really helpful in terms of giving a presentation and educating the women on the flu vaccine, being available to answer any questions and provide support for whether they were getting the vaccine or their children were getting it. That was really huge, and we were really excited to have her with us. And then our NOW's volunteers kind of helped with intake and consent forms. So we use CDC vaccine kind of standard consent forms. We created our own NOW's outreach consent form, just saying that all of their information was going to be stored in a HIPAA compliant way. And then we actually had the Student Run Homeless Clinic volunteers administering the vaccine. And after all of that, we sent the families to another station where they pulled up their record in the Louisiana Immunization Record System. And if there were any gaps in their vaccines, we actually referred them, the children at least, to the LSU free clinic Tiger Care. So something we thought was really important in providing this vaccine was that we're not trying to replace their primary care. We want to make sure that they still had access to primary care, and we encouraged them to set primary care appointments and gave resources for them to be able to do so. So we vaccinated a lot of women and kiddos on this day, and this clinic has continued to happen every year in November. And so what we really learned is that when you give people the proper education and access to healthcare resources, they're a lot more willing to accept them. Partnering with public health organizations was extremely helpful in providing the vaccines, and using healthcare students who are trained to administer vaccines and are eager to practice is a great way to provide free care as well to the community. So what I didn't expect was that this kind of service project would turn into something I could turn into research. But during my third year, I was encouraged to kind of take what we did and present it formally at some conferences, which my fellow co-director and I did. So we presented at a public health conference in Miami, and then the National Public Health Conference that was in San Francisco this year was unfortunately virtual, so I didn't get to travel. But I did get to learn how to present a poster virtually, which was definitely an experience. So I think something I've learned in public health is to just say yes to opportunities when they come your way, because sometimes it's really hard to envision where you're going to go next and what you're going to do with your public health experience. But when opportunities present themselves, and they always do, just say yes to them, because there's a lot that can come from them. So where am I going next? I am currently a fourth year in medical school, so I'm in the process of applying to OBGYN residency. I will find out in a month-ish where I match. So my next couple of years are really going to be focused on clinical practice and being a great OBGYN. And I'll still be kind of figuring out where does public health fit into my career. But I think there's really wonderful people out there that inspired me at LSU, especially. We had MD and MPH leadership series. So there were times that we had people like Dr. Gee and other people who had MD and PH degrees come in and just share with us what they've done with both degrees. I think sometimes we get a lot of influence from medical school and then public health school, and sometimes it's hard to figure out where those two paths converge. But I was really grateful that LSU provided a lot of people and leaders for us to look to in that. Yeah, so I'll stop there and kind of leave it open for any questions.